lady from Georgia, Ms. McBath. Thank her for her service to this committee. Ms. McBath?
Thank you, Madam Chair, and good morning to our witnesses. I'm really pleased that you all have been able to join us today as we continue to discuss this a critically important piece of criminal justice legislation, the First Step Act, and to examine how the Board of Prisons has responded to the COVID-19 pandemic. And I remember specifically the day that the Judiciary Committee, we had a hearing and we also had discussions on the compassionate release of nonviolent offenders under COVID-19 conditions. And today I am glad that we are revisiting what appears to be the Board of Prisons stalled implementation and also their neglect of just the basic health policies and practices for those that are incarcerated. We know that the First Step Act was a major stride forward in criminal justice reform designed to address the systemic issues in our federal prison system. And this bipartisan piece of legislation was crafted to reform sentencing and improve prison conditions. And it measures, it include adding anti-recidivism programs, amending sentences based on good time credits, and expanding the rights of female inmates, particularly female inmates who are mothers. So the First Step Act, for example, requires feminine hygiene products to be free and largely prohibits the use of restraints on pregnant women and those that are in postpartum recovery. And despite these positive reforms, since the bill was signed into law on December 21st, 2018, many of these provisions have not been implemented. And it is our responsibility here as policymakers to ensure that the transformative wins of this bill are fully being carried out. So my questions are for Ms. Goodwin today, and thank you so much, Ms. Goodwin, for visiting us again today. I really appreciate you being here. In your 2021 report on pregnant women in federal custody, you found that out of the Board of Prison policies that address the treatment and care of pregnant women, that only 8 of these policies were fully aligned with the national guidance for the health and safety of pregnant women. And following this report, the Board of Prisons improved their policies to align with national standards. Can you attest to that?
Yes, thank you, Congresswoman. So that's correct. When we did the work looking at the care and treatment of pregnant women in DOJ custody, we found that with those national standards, BOP wasn't fully aligning or had not fully aligned with quite a number of them. And those national standards speak to issues around providing, nutrition, providing prenatal care, providing mental health services. And we also looked at whether or not they were restraining pregnant women. And so we made our recommendation to BOP. They agreed with the recommendation, and they are in the process of fully aligning the ones that we have a table where we note what was fully aligned and what was partially aligned. And so they are in the process of fully aligning the ones that we found to be deficient. However, we are leaving that recommendation open until all of those categories that we noted are fully aligned. So we will be circling back to BOP to find out where things are. And then another recommendation that we had was to the U.S. Marshals about the restraining of pregnant women.
Well, thank you. And I think this committee would be more than interested to have access to that information and that data once you have access to it as well. I'd also like to know, since the COVID-19 pandemic, has the Board of Prisons implemented additional policies to protect pregnant women from the increased risk of the disease itself?
My understanding is that they have. What is interesting about the pregnant women's report that we did, we did our last site visit in January of 2020, like right as everyone was beginning to understand, how dangerous the pandemic, the virus was. And then as in the process of pulling the report together, we did circle back to BOP to ask about what they were doing in terms of protecting pregnant women. And so they talked about providing, special housing, putting pregnant women in additional, special locations to keep them away from the general population. But that's something we didn't go into a lot of detail in. It is something, as we do future work on how BOP treats pregnant women, it's something that we will definitely look into.
Well, thank you so much. We really appreciate that. And there again, also, Ms. Levy, I am so sorry for, all that you've appeared to suffer through. And it's just kind of disturbing to hear that there may be others as well that are incarcerated that are going through some of the same kinds of conflicts and problems. With that, I yield back.
Gentlelady yields back. Now I'd like to recognize Mr. Tiffany.